also be sharing it on social media. We have American Sign Language for today's meeting. The interpreters will be pinned on the screen for those who need them. Additionally, we also have captions available. To view the captions, click on the Show Captions icon in your toolbar. For captions in other languages, click the up arrow icon next to Show Captions. Click Speaking Language to select the language you'd like. With that, it is my pleasure to turn it over to Yvette Pegues to kick off today's webinar. Yvette, the floor is yours.
Thank you so much, Claire. And thank you for each of you joining us today, whether live or in the replay from all over the country. My name is Yvette Pegues, and I am so proud to serve on the ARC of the United States board and co-lead the National Council of Self-Advocates. At the height of my engineering career, everything changed in an instant. One morning, I woke up with a stronger than usual migraine and numbness on the right side of my body. A trip to the ER turned my world upside down when doctors told me that my brain was literally slipping into my spinal column. I underwent brain surgery, but complications left me paralyzed. I couldn't walk, I couldn't talk, and I couldn't work. I went from being an independent, energetic, busy mom and entrepreneur to someone who needed help with the most basic tasks like getting dressed and bathing. My recovery took 2 years, and during that time, my medical bills piled up while my income disappeared. But Medicaid was my family's saving grace. It not only covered my medical needs, but it also gave me a chance to care for my family and show my children that I could survive and thrive. That's why I know how vital Medicaid is for millions of people with disabilities and their families across the country. There's no question that we have a lot of work to do to protect this critical program. But seeing this amazing group of advocates here today, I know we can rise to the challenge together. On this slide, there's a picture of me. I'm an African American woman with brown hair and fun purple lipstick. I'm joined by two incredible staff at the ARC. Kim Mushino, the ARC's Director of Medical Policy, who appears in this picture as a white woman with short hair wearing a red sweater. Claire Manning, who you heard earlier, is the ARC's Senior Director of Advocacy and Mobilization. She's pictured here with blonde hair, black and white checkered blazer. So we're here today because Medicaid is a lifeline for people with disabilities and their families, and it's under serious threat. Some decision makers in Washington, D.C. are looking to cut costs, and Medicaid is on the table. These aren't just hypothetical risks. This is happening now. We need everyone's help to protect Medicaid. So over the next hour, we will explore why Medicaid is so important for people with disabilities, break down why it's at risk right now, and dive into the actions that you can take to protect it. And of course, we'll answer your questions and hear your ideas. On this slide, there's a picture of a young man wearing a gray t-shirt that says, "Disability rights are human rights." Across the country, people with disabilities rely on Medicaid for critical services, healthcare, employment support, early intervention, in-home care, and so much more. Here's Mike, an advocate from Indiana.
Hello, my name is Mike Dunn. I'm a father and a husband, and I was born with cerebral palsy. Growing up, my American dream was to own a home, have a job, be married, and have a family. But I didn't think that was going to be possible with all the help that I require with my personal hygiene and just everyday living. The Medicaid waiver has allowed me to fulfill my American dream. It has allowed me to live the best life I can possibly live, as independently as I can possibly be.
It's amazing to hear Mike's story, but now I'd like to hear from you. Why does Medicaid matter to you? Here are some of the big ways that Medicare helps people with disabilities. So we invite you to take the poll on your screen now and select as many answers that apply. While you're doing that, I'll read through. Being able to live in my community, health insurance, getting support in my house, finding and maintaining work, supports in school. Again, we invite you to select as many items on this list that apply. Let's stand by for the poll results. This may take a moment. Remember, select as many that apply to you. You should be able to see the results on your screen, and we have 78% of people who need to be able to live in their community, 88% having health insurance. These numbers make a difference. Yes, there is so much at stake. Now let's share the same passion and results and power to Congress. With that, I'm going to turn it over to Kim to tell us more about Medicaid and why it's at risk. Kim, the floor is yours.
Thank you so much, Yvette. As you know, Medicaid is a federal and state program. And here on this slide, you can see a picture of Congress representing the federal government and the states, the country with all the different states. Because Medicaid is a shared program between the federal government and the states. Congress decides the basic rules about Medicaid and how it's paid for, and states have to follow these rules. But states can choose who's eligible and much of what services are available to people in their state. But Medicaid provides really critical health care to low-income individuals and also long-term services and supports for millions of people. In fact, it's close to 80 million across the country. On this picture, we see families and individuals with disabilities. Medicaid is crucial for lots of people, and especially people with disabilities across their entire lifetimes. Medicaid covers comprehensive health care for children with disabilities. It pays for important services for infants and toddlers, like providing an actual diagnosis of what their disability is. It provides therapies to those young children, as well as healthcare. Not just healthcare, but also mental health. And while kids are at school, they get therapies that are provided in their individual education plan, their IEP, while they're at school. It actually helps people get and keep jobs. Most of our long-term supported employment is actually provided by Medicaid. Of course, Medicaid pays for long-term supports and services, including home and community-based services. Medicaid and Medicare are both government programs that help people with their healthcare costs, but they serve different groups and work in different ways. Medicare is mainly for people 65 and older, as well as some younger individuals with disabilities. It's a federal program, meaning that rules are the same across the United States. People usually qualify based on their work history and contributions to Social Security, and it pays for hospitals and doctors' visits and outpatient care, prescription drugs, and things like that. But not really long-term care, very limited home care. Medicaid, on the other hand, is for individuals with low income primarily, including children, pregnant women, elderly individuals, and people with disabilities. It's different than Medicare because in that it's a joint federal and state program. So the rules and coverage can vary depending on the state. It covers many healthcare costs, sometimes including things that Medicare doesn't pay for, like long-term care and nursing home care. And then some people qualify for both Medicaid and Medicare, which helps cover more healthcare costs. Sometimes we refer to people that have both as dually eligible. While Medicaid is the official name, many states have their own unique names for their Medicaid programs. These names often reflect their state's branding or emphasize healthcare access. For example, in California, they call it Medi-Cal. If you're from Massachusetts, you know it by Mass Health. In Illinois, they call it Health Choice Illinois. In New Jersey, they call it New Jersey Family Care, and in Texas, they call it Texas Medicaid and CHIP. So each state's Medicaid program also has different eligibility rules, benefits, and enrollment processes. So if someone is looking for Medicaid in their states, basically they should look, for their specific name or visit the state's health department website. So Medicaid is funded through a partnership between the federal government and individual states, as I mentioned before. The federal government provides a base percentage of Medicaid costs through what's called the Federal Medical Assistance Percentage, or FMAP. This percentage varies by state. It depends on the state's average income levels. So wealthier states receive less federal funding, while poor states receive more. This is typically between 50 and 80% of total Medicaid costs. States must pay the remaining portion of the Medicaid costs. And then the states use general state tax revenue to fund Medicaid. Others rely on provider taxes, hospital assessments, or other dedicated funds. But states have flexibility how they structure their Medicaid program, but they must follow the federal guidelines. The federal government sets broad rules for Medicaid. For example, required benefits and eligibility categories, but they're able to design their own program within those rules. So they can choose which optional benefits to provide, like respite care or dental services. They can add additional eligibility groups and different provider payment rates. So that's just a little bit about Medicaid. Now, why is Medicaid at risk? And here on this slide, you can see a big target. Because we now have a new president and Congress, and Republicans have a very small majority in both the House and Senate. But what we know is what we're hearing is that they're talking about priorities, and their priorities are to decrease the size of the federal government. They've also announced plans to extend or pass additional tax cuts. But to do this, without increasing the deficit, they need to find ways to pay for those tax cuts. The Budget Committee chairman released a whole list of spending cuts that they might use to pay for these tax cuts. So, and we know that a very large portion of those come from Medicaid. So we need to make sure that they understand how important Medicaid is and that they get the message that cutting Medicaid for tax cuts is just wrong. So we know that our states are already in crisis and we need to increase funding for Medicaid, not decrease it. Some states have waiting lists for home and community-based services. Some states limit who can access services. Some providers won't even see people on Medicaid because of the low reimbursement rates that Medicaid provides. And this needs to be increased, not decreased. So any cuts to Medicaid would put even more people in danger. So what are the threats? How are they gonna make these cuts? We're hearing that they would, some of the ideas that they're looking at are work requirements. We believe that work requirements equals paper work requirements. People who use Medicaid would have to prove that they can work because of an illness or a disability. And people would have to fill out even more paperwork to keep Medicaid. So we know what's really behind this is to reduce the number of people on Medicaid. And we know from past experience that work requirements don't work. They don't help people get work. Taking healthcare away is certainly not a way to help people work. Instead, they should be providing supported employment. We also know that they're thinking about making it harder for states to raise money to pay for services. One way to do this would be to put limits on provider taxes. And that would just make it really hard and provide less federal money for states to run Medicaid programs. We also know that they're thinking about block grants or per capita caps or limits. These plans just cut federal funding at the federal level. They put a limit on how much money would go to each state. And then the states would have to make up for the rest. And block grants would get worse over time. And we know from past fights over cuts to Medicaid that this is one of the top threats to Medicaid. We also have heard they want to end the Affordable Care Act expansions to Medicaid. When the Affordable Care Act was passed in 2010, part of it was to try to provide insurance through Medicaid to millions of people that were not able to get access to Medicaid through the very strict normal pathways. So they extended Medicaid. We know that about 40 states have taken up that expansion, and now that expansion is under attack. And this would be terrible because we know that a lot of the people, individuals that are receiving Medicaid in those expansion states are actually people with disabilities. So all of these will basically lead to states getting less money. So here's what we know about the timing of these threats. We know that and I have on this slide a picture of a stopwatch to show that the time is now. They are thinking about these ways to cut Medicaid right now. They had just this week, they talked about trying to get a budget with these ideas in it by the end of this week. And they would like to have a bill signed by the president by the Easter congressional break. So that's fast. And that's why we're talking to you now, because we really need you to help us educate members of Congress and also state policymakers. So we need your help. And so with that, I will hand it back to Yvette.
Wow, Kim, thank you for helping me understand what's at risk. And now that you on this webinar know what's at stake, it is time to learn about how you can get involved in making a difference. Claire, take it away.
Thank you, Yvette. And once again, a huge thank you to all of you. We have almost 1,500 people on this call. That is incredible because we need your help. I'm Claire Manning. I'm our Senior Director of Advocacy and Mobilization. I am a white woman. I have blonde hair. Today I'm wearing a green sweater. I know that we can protect Medicaid if we all work together. And there are 3 things that we need everyone to do so that we ensure that all members of Congress understand how important Medicaid is for people with disabilities and their families across the country. Number 1, act now. I'm going to tell you how in just a second. 2, stay updated because things are moving really quickly. And 3, there is power in numbers. We need to get other people involved. So first up, act now. The number 1 thing that we need everyone to do, basically, get off this call when it's over and contact your members of Congress and tell them what Medicaid means to you or your family. This might sound a little bit scary if you've never done it before, but it's really important to remember that your members of Congress work for you. They represent you and they need to know what's important in your life. That is critical. Now, I'm going to go over several ways to take action, and don't worry about the links. Like I said earlier, they're all in the webinar here. They're all in the slides, but we will also put them out on social media, and you will get a copy of all of this by email probably in the next 12 hours. So don't worry about scribbling them down really quick. So first up, the arc.org/action. This is our action center where you can go type in your address and really quickly and easily get connected with your members of Congress. You can send an email, do a tweet, which is really great because it's public. You can make a phone call. I suggest that you do all 3. That's wonderful. Here on this slide, we have a picture of our action center. It includes some families, some children. And when you contact your members of Congress, share your story with them. Tell them, kind of give the examples, some of the examples that Kim provided about really what Medicaid means for you, how it impacts your life, really educate them. We also have a toolkit to help you kind of craft what that could look like with some best practices on sharing your stories with members of Congress. And if you're able, in DC in April, we are going to be hosting the Disability Policy Seminar. It's a several-day conference that we do every year with several other disability organizations. And we include the last day of the conference is on Capitol Hill, where participants will be able to meet directly with their members of Congress and staff, kind of take the fight right to them and talk about the issues that are important in our lives. Now, this next slide includes a picture of advocates from the ARC wearing orange t-shirts that say disability rights are human rights. And what I want to share here is that if you haven't already, I recommend that you connect with your state and local chapters of the ARC because, as Kim said, Medicaid is a federal and state program, so these impacts are going to be happening on the state level as well. So it's really important that there's state organizing and advocacy happening. If you are a person with a disability, I highly recommend that you consider joining our National Council of Self-Advocates. Our National Council of Self-Advocates meets monthly where they do advocacy training, talk about different current issues and how to get involved, and it is co-hosted by Yvette. Next up, stay updated. If all the back and forth yesterday kind of showed us anything, is that things are changing really quickly. So if you are not already following the ARC on social media, and I have on this slide here pictures of all of the different social media platforms we are on, which is almost all of them: LinkedIn, YouTube, Facebook, Instagram, X, Blue Sky. You can find us anywhere. So I really encourage that you follow the ARC. And if you're not signed up for emails with us, you can do that by going to thearc.org and putting in your email address. So that way you can also stay up to date with things and actions that need to be taken. And lastly here, as I said at the top, we need more people involved. There is power in numbers. It is so important that you are sharing this information with your friends, with your families, with your neighbors, with your coworkers, to tell them how important Medicaid is to you, explain to them what's going on, explain to them the threats, and ask them to contact their members of Congress and get involved as well. I know this is a fight that we can win if we all work together, so we're going to bring even more people into that. Now it's time for my favorite part as a community organizer, a little bit of homework. What is your next step? What can you commit to as your next step in protecting Medicaid? We have a couple of options up here, but of course you can choose your own adventure. Are you going to use the ARC's Action Center, the arc.org/action, to contact your member of Congress? I hope we have 100% on that. Share information with my friends, family, and coworkers. If I'm able, go to the Disability Pulse seminar in DC. And I will wait for a second here to get responses recorded. And I continue to appreciate the enthusiasm with the celebration emojis and the heart emojis and the thumbs up emojis. Okay, we're at 89%. I bet by the end of this call, we can get that up to 89% of folks going to the Action Center, 89% sharing information, 20% going to DPS. That's great because there's so many important conversations that can be happening in your states as well. You do not even have to come to DC. Thank you to all of you for being on this call and for your commitment that you just made to advocating for Medicaid and the 1 in 5 people in our country who rely on Medicaid services. Yvette, back to you.
Wow, Claire, thank you so much. Our story and our voice is truly our power. And I'm definitely looking forward to sharing all of this information, time, and the Capitol Hill steps with each and every one of you in April. I also want to thank you for submitting your questions in advance. So here are a few that you've asked. We're going to bring Kim back in to get the answers, starting with, how will Medicaid waivers be impacted by potential cuts? Kim?
Well, sure. As most of you know, Medicaid waivers allow individuals to get supports and services at home or in their community rather than in an institution or other facility. So any funding cuts to the Medicaid program could impact these services. If the federal government cuts back on funding, states will have to raise taxes, like I said before, or cut back on services such as those that are provided in the Medicaid waivers. They could also cut eligibility for waivers, and that might lead to increasing the waiting lists that are already way too long.
Super important, Kim. We have one other question, if you'll help us out with this one. Basically, we are hearing concerns about the recent executive orders from the president and freezes on federal grants. So, Kim, what can you say about the possible impact on people with disabilities like me?
Well, we are disappointed about some of the recent executive orders, especially attacks on diversity, equity, inclusion, and accessibility. But please also remember that executive orders are not laws, and our laws are still in place. They cannot change laws without Congress. So we still have the Rehabilitation Act, we still have the Americans with Disabilities Act, and so on. So I would just stay in tune with the ARC, and we'll make sure to ask you to take actions when we think that they will, make a difference. And we're in regards to yesterday's confusing announcements about freezes of federal grants. Again, it's not easy to stop federal funding without Congress. So we'll have to let lawyers deal with that issue, and we've already seen that the pushback that the federal government got over that chaos actually had an impact. And the memo that came out yesterday was already withdrawn. And today the president made a statement, saying that what they're really doing is they're looking at federal grants to make sure that they're complying with some of their the agenda items, but he said that it didn't apply to Social Security, Medicare, or Medicaid. But we here on staff have expertise, and we are in coalition with members that have expertise, and we are watching all of this very, very closely. And we'll make sure that you all get the information that you need, and information about action steps when we feel that they can make a difference. I hope that helps. Hope you're on mute.
Thank you. That's really helpful to me. And based on some of the reactions, the hearts and the thumbs up and the applause, I think the audience agrees. So I just want to say thank you to Kim and Claire. And thank you again to every single one of you for joining today, whether you are live or watching the replay. We will definitely send out all of the mentioned materials to you. And again, please stay tuned to the ARC for more ways to get involved and to get more information as we know more. Again, things are moving quickly. And I just want to just personally say, as a disabled woman of color, a mom, and an advocate, Medicaid is my lifeline. And I really do believe that together we have the power to protect it, not just for me, but for you and for all who depend on it. The time is now. And together we are powerful. And I know that we can protect Medicaid. Thank you for joining.